Good afternoon. My name is Father Stephen Kirker. It's good to be with you all. I'm sorry I can't meet you in person. This is a new experience for me. I'm doing a webinar and I've not done an online talk before, so please be patient. A little background on me. I'm a priest of the Westminster Diocese, and up until 1989, I was an Anglican priest. And with my wife, in that year, we became Catholics. And with special permission from the Holy See, I was ordained as a Catholic priest in 1996. We have 2 grown-up daughters and 3 grandchildren, one of whom was born just a couple of weeks ago. I have a background in health. When I first left school, I worked in hospitals, both here and in South Africa. And when I returned to this country, I met and married Stella, and we moved straight away to Oxford, where I trained for the Anglican ministry. My final parish in the Church of England was in Bradford and included the chaplaincy of a psychiatric hospital. So after leaving the Church of England, I worked as a deputy manager of a project run by a national charity in Croydon. And this was for 26 adults who needed medium support to live in the community. And after 5 years, I moved on to a project in Barnes as a manager for a similar project for 13 people who needed medium support to live in the community. It was a charity founded by concerned parents who felt that there was no provision for their mentally ill children in the community. So they funded this one home. Most of our clients were schizophrenic, although we did deal with other forms of mental illness, and I was the senior professional and responsible for the Board of Trustees. In the meantime, my case had gone to Rome for permission for ordination as a Catholic priest, and I was ordained in 1996. Rome considered that the work that I did was pastoral, and so I continued. And I was also attached to a parish which had Feltham young offenders in it. And the prison had its own chaplain, but when he was away, I covered for him. And that was how I got into prison ministry. And I became a full-time prison chaplain in 2007. I was full-time chaplain for 11 years and retired from full-time chaplaincy in 2018. I was 5 years at HMP Highdown in Banstead in Surrey, and also saying Mass at Downview, which was a women's prison nearby. I then spent 6 years at HMP Pentonville, which is near King's Cross, an old Victorian prison, very different from Highdown, which was a 1980s build. And I still say Mass at the Mount near Hemel Hempstead, and the work that I did with people with mental health difficulties obviously helped me in my work in prisons. First of all, I'm just going to spend a minute explaining to you the different categories of prisons. First of all, category A, this is the high security prisons. Category B is the local prisons, and most Cat B prisoners are on remand awaiting trial. And when they're sentenced, they're recategorized. Category C are prisons where prisoners serve their sentences once they're sentenced and hopefully have some sort of work or education. Category D prisons are very low security, usually for people deemed a very low risk. For example, white-collar crimes, people who are coming to the end of long sentences who are then rehabilitated into the community. All prisoners, whatever category, should be medically assessed on entry into prison so that their mental health and physical needs are identified. Why am I telling you this? Well, the level of intervention that we could give as chaplains obviously varies according to the length of time that a prisoner is in the prison. And I mostly worked in Cat B local prisons, where the prisoner's average stay was around 8 weeks. So it's very much sticking plaster chaplaincy. Moving on to chaplaincy. Why do we have chaplains? Christians are needed in prison. The good news of Jesus Christ is as relevant there as anywhere else. Jesus stood up in the synagogue at Nazareth and gave his first homily, quoting Isaiah. He has anointed me to bring good news to the poor, to proclaim release to captives, sight to the blind, to let the oppressed go free, to proclaim a year of the Lord's favour. So what do chaplains do all day, apart from drinking lots of tea and coffee? Well, my day usually started early, and by 8 a.m. I was catching up on emails and answering phone messages before attending the governor's morning meeting. This was for the senior staff and departmental heads, and it was an opportunity to receive a report of the previous day's incidents from the duty manager. It gave me a feel for the mood of the prison and what was going on, as well as the chance to see colleagues from all over the prison. Chaplains do statutory duties, visiting all new prisoners for their faith needs and to check on their welfare. Also visited with those in healthcare and those who've been segregated, either for their own protection or for breaking the rules. And these tasks were divided between the chaplains on rota. After that, there was time for other work, such as visiting prisoners who requested to see me, hearing confessions, and doing some admin work. I heard lots of confessions in prison, good confessions on the whole, and probably more confessions per head of population than you would in a parish. In fact, I helped a friend out at his reconciliation services in a parish near where I lived at that time. And he was always saying the same thing as he introduced the priest there. If any of you are big sinners, you can go to Father Stephen. He's heard it all before. I do believe, by the way, that if more people went to confession, there'd be less work for psychiatrists. In the prison, when I walked through the wings, I always stopped and talked to staff, especially after 2010 and the cuts, which I'll talk about later. Staff morale was very low. Chaplains are there for the staff as well as the prisoners. And as well as this, those on suicide and self-harm watch were visited by their faith chaplains weekly. There were various meetings to attend, such as suicide and self-harm prevention, reviewing those prisoners who had been segregated, and also meeting with outside agencies. Chaplain was usually in the office answering the phone, often from concerned relatives, and also from staff requesting that we visit prisoners. Relatives were usually, but not always, supportive. I had one prisoner go on at me for ages because as soon as he was imprisoned, his family had his dog put down. I also did a staff mass weekly, and a sister came in on a Thursday. She did a Catholic group, which always included a decade of the Rosary and some teaching. We had a very good catechetical course designed for prisoners called Faith Inside. I also had a Catholic lay chaplain who came in a couple of times a week and helped with the pastoral work, as well as doing a meditation group. Rosaries were in big demand. The only ones we were allowed to give out were the nasty plastic ones with string, so that they couldn't harm either themselves or someone else. And I was grateful to the Catenians who gave rosaries, which did help cope with the endless demand. I have a great love for the rosary, a love that's grown as the years have gone by, and was very keen to see it used for what it was meant for, a form of prayer, but not the decoration. I often see young men on the street wearing plastic rosaries. That's a good chance that they've been inside. Visiting new prisoners could also be interesting. Soon after I started at Highdown, when I was quite new at prison chaplaincy, I was visiting new prisoners. And I went to see a prisoner who wasn't in his cell when I called. I was about to leave when his cellmate stopped me and said that he was worried about him. "I think he's suicidal," he said. My ears pricked up immediately, and I asked why he thought that. "He keeps licking the paint, Father," he said. I was surprised and suddenly thought of lead paint. "But paint has no lead in it nowadays." His cellmate responded with a twinkle in his eye. "I know that, you know that, but does he know that?" His cellmate was an old lag with plenty of prison experience, and he had spotted a new, rather green chaplain. I was being sent up. I always kept reception visits brief. Occasionally, I'd be told to FO, but on the whole, prisoners were pleased, surprised to see us. I would see all prisoners when it was my turn to do receptions, of all faiths and none. Chaplaincy teams are interfaith, and it's important that we work together as a team. The advantages for the prisoners was that they were being seen by somebody who was slightly remote from the system. Somebody who wasn't seen as part of the prison setup. And the important thing in our dealings with prisoners is that we treated them with dignity and respect. Perhaps one of the saddest things that we had to do as chaplains was informing prisoners about family death or serious illness. If the family wished, we would inform the prisoner. Prisoners were only allowed to attend the funerals of close relatives. If they couldn't or didn't want to attend, we would offer them prayers in chapel, as near to the day of the funeral as possible. Needless to say, other family and relationship difficulties were also discussed with us. The work was never boring, and I was never quite sure of what was going to happen. Whilst I was at Pentonville, we had 2 escapes and a murder. Part of being a chaplain is knowing what you can and can't deal with. An example of that is that I never got involved in legal matters because I had no expertise. I now want to move on and talk about mental health in prison. I'm going to give you some facts and figures about mental health in prison in a moment. But before that, I just want to tell a story which illustrates that dealing with people with mental health difficulties is not always negative. Discipline in chapel for Sunday services was the responsibility of the chaplain conducting the service, assisted by uniformed staff. Noise, mostly talking, varied, and at the particular time that I'm talking about, we were going through a bad patch where I was having to ask them to be quiet quite a lot during Mass. We had a prisoner, let's call him Bill, who was built like a brick outhouse and spent most of his time in prison being segregated, either for disciplinary matters or for the protection of others. To my lay view, he could possibly have had psychopathic tendencies. Now, Bill was very devout and came to Mass every Sunday. He had nothing to do with the others, sat on his own, near the front, mostly staring at me, which was slightly off-putting. I would get requests to see him when he was in segregation, and it was always to get the seg staff to allow him to come to chapel, which, to be fair to them, they often did. He was always polite to me and well behaved, and I was always happy to encourage staff to let him come to Mass. On this occasion, when the congregation didn't respond to my request to be quiet, Bill stood up, faced the rest of the congregation and shouted, "Shut up!" And they did. You could have heard a pin drop in the chapel that day. Anyway, some facts and figures for you. In July this year, there was 87,900 people in prison. The UK incarcerates a lot of people, with only the US exceeding us in the Western world. As you can imagine, it's difficult to get exact numbers of those with mental health difficulties. 26% of women and 16% of men said that they had received treatment for mental health in the year before custody. 25% of women and 15% of men in prison reported symptoms indicative of psychosis, and the rate among the general public is about 4%. Self-inflicted deaths are 8.6 times more likely in prison than in the general population. 70% of people who died from self-inflicted means while in prison had already been identified as having mental health needs. However, the Prisons and Probation Ombudsman found that concerns about mental health in prisoners had only been flagged on entry to the prison for about half of these people. The Prisons Watchdog has made the unprecedented move of calling for an independent investigation into suicide and self-harm across jails in England and Wales. It's a big problem. Rates of self-inflicted deaths and self-harm in prisons has risen significantly in the last 5 years, suggesting that mental health and overall well-being in prison has declined. People with mental health difficulties are inclined to feel despair, isolation, and disempowerment inside. Death in prison is devastating for both staff and prisoners and is taken very seriously. There is a whole safer custody department in each prison whose sole purpose is to keep prisoners safe. Figures have revealed that 86 people, of which 70% had known mental health conditions, took their lives in prison in the year to June 2019, compared with 81 the previous year. Self-harm incidents reached a record high of 57,968 in the 12 months to March 2019, up 24% from the previous year. Juliet Lyon, chair of the Independent Advisory Panel, told the Independent newspaper that including mental health, alcohol and drug requirements in community orders, that's non-custodial orders, represented a very successful early intervention, but the government was failing to do this. She said that the measures would prevent people from getting more ill or deeper into the criminal justice system. She said people's mental health is less likely to improve, and if their mental health or substance misuse is a factor in their reoffending, and that's not dealt with or treated, then the likelihood is that they would continue to offend. Ms. Lyon added that early treatment would reduce the number of suicides and self-harm in prisons. There's a growing concern over the rise of both of these trends, with campaigners urging the Justice Secretary to take urgent action to tackle sentencing policy, reduce the prison population, and redirect resources to community health and welfare services. In other words, catch them early before prison becomes a factor. I could go on, but I hope that this gives you a flavour of the difficulties concerning mental health in the justice system. Treatment is often difficult in prison, with medication being the likely option. I have no proof for this, but my own observation while working in the system suggests that prescribing was often the old antipsychotics. Medicating prisoners was also a problem, as there was a black market in medication, and also bullying to get prisoners to conceal and pass on their meds. They were watched carefully, but it still went on. Healthcare in prison was dominated by those with mental health difficulties. In Pentonville, we had a 22-bed healthcare unit, which was divided into 2 wards, equally between those with physical problems and those with mental health difficulties. Mental health often intruded onto the physical health side. Due to lack of space, attempts were made to contain mental health difficulties on the wings. There seemed to be difficulties in getting special hospitals like Rampton and Broadmoor to take those with severe psychosis. This usually meant that they were left for healthcare to cope with, borne out by the reports that I will quote in a moment. Recreational drugs also played a part in mental health difficulties, with the rise of the new synthetic cannabinoids, such as spice, causing major difficulties. The seemingly endless supply of drugs in prison, despite the staff's best efforts, add to the problems of those with existing mental health difficulties. On occasions, there was an overpowering smell of weed on the wings. And sometimes when the smell of weed was bad on the wings, I used to say to the seminary students on placement with me about the advantages of a placement in Pentonville. You could get stoned for free. On a more serious note, the House of Commons Committee on Public Accounts report, Mental Health in 2017 to 19, had the following to say. People in prison are more likely to suffer from mental health problems than those in the community. NHS England estimates that 37% of its budget spent on adult healthcare in prisons is on mental health and substance abuse, which, it told us, is more than twice the proportion that is being spent within the NHS budget as a whole. Complex social and personal issues, such as a history of unemployment, substance misuse, or trauma, are more common among the prison population, and being in prison can exacerbate poor mental health and well-being. In turn, untreated mental health conditions, especially schizophrenia and personality disorders and substance abuse disorders, are associated with higher rates of suicide and self-harm. There is no one size that fits all solutions to these issues. They go on to say that it's a disgrace that too many prisoners wait far too long to be transferred to hospital or secure units. People with acute mental health problems should wait no more than 14 days to be admitted to a secure hospital, but the majority wait for far longer than this. In 2016-17, 2/3 of prisoners who needed treatment waited longer than 14 days to be transferred. Witnesses agreed that the levels of self-inflicted deaths and self-harm in prisons was appalling and a damning indictment of mental health services within our prison system. The Ministry of Justice acknowledged that the level of staffing had been detrimental to the security, stability, and order in prisons, including the mental health of prisoners. There has been a huge switch in drug use amongst prisoners, they continue to report, towards new psychoactive substances, also known as spice, which existing detection and treatment programs were not designed to address. These have changed the nature of how prisoners behave when under the influence of drugs, and are a very real danger to both prisoners and prison staff. Spice is now a substantial problem in prisons. I would just like to visit something that quote said concerning staffing. The cuts in public services by the government in 2010 were devastating. Prisons were at times chronically understaffed. Violence increased. Incidents of staff losing control of prisons rose. And worst of all, prisoners spent longer confined in their cells and opportunities for activities were reduced. A simple example of this is gym. Now, gym is important to a large number of prisoners, and due to staff shortages, gym staff were often sent to cover wings, so gym was cancelled. Visits to the library also suffered due to staff shortages. Officers were moved from wing to wing. Subsequently, they didn't know their prisoners. Pre-2010, I would go to a landing, I could ask an officer on the landing about a prisoner, and he'd be able to tell me something about him. Often, post-2010, they didn't know, which didn't make me feel particularly safe. They'd probably been on a different wing the previous day. The London Assembly Health Committee report of 2017 had the following to say about London prisons. Overcrowding. Key London prisons such as Wandsworth, Brixton, Thameside and Pentonville are significantly overcrowded, with Wandsworth the worst, holding 50% more prisoners than it should. Reports suggest that many aspects of prison life are negatively affected by the state of overcrowding in the prison system. For example, living conditions in Pentonville Prison were found to be adversely affected by the chronic overcrowding, with cells originally designed for one prisoner holding two. Equally, overcrowding was significantly affected the prison regimes, with a considerable number of prisoners spending up to 22 hours per day locked in their cells. Violence. April 2017 Ministry of Justice data shows violence in prison had reached record highs. Assaults in prison rose by 27% on the previous year. Prisoner-on-prisoner assaults by 23%, and assaults on staff by 38%. Gang violence and violence between prisoners make prison even more unpleasant. And in spite of overcrowding and poor conditions, however, there are those who come back time and again. For some, prison is better than the streets. Others found difficulty in coping with the world outside the walls and come into prison because they don't have to make many decisions. They were told what to do, have a roof over their head with no bills, and get 3 meals a day. If your expectations are low and you can keep out of the aggro, then I suppose it's okay. Others reoffend constantly because they have a habit to feed. Others are professional criminals for whom jail is an occupational hazard. I was asked to spend a few minutes talking about mental health as a chaplain and in my previous experience. The symptoms of a big proportion of people suffering from mental illness are unrecognized, undiagnosed and untreated for a significant period of time. In prison, we have to remember the average reading age is 8 compared with 12 on the street, and there is above average illiteracy. Educational achievement for some, not all, is poor. My experience is that people suffering from mental illness need to be listened to. Communication is most important, expressed with empathy and sensitivity. They need time and attention to be heard and not dismissed. And that was one thing, perhaps as chaplains, that we could offer more than the overstretched medical staff. Speak to them and let them speak to you. They're not necessarily looking for solutions, although this may be what they would like. We're looking for someone to listen with empathy and sensitivity. Sometimes, dealing with mental health difficulties, we get tempted to offer solutions and bombard the person with questions that they may not be able to cope with. This may result in them becoming defensive and argumentative. Therefore, I think a way forward is to accept what a person is presenting without interrupting and giving them a chance to express themselves. If you offer information or suggestions, there may be a difficulty in comprehending your message. Mental illness is often associated with poor concentration and can interfere with accurately interpreting what is being said. Sometimes thinking is confused, and that makes understanding complex ideas difficult. Therefore, be straightforward and direct. It may be necessary to repeat important information, for example, the importance of taking medication. When I speak to prisoners, especially those I think may be experiencing mental health difficulties, I greet them with a smile and try to speak in a manner with non-threatening body language, so my words and actions convey respect and calmness. I try to use simple words, no long explanations, speaking in short sentences. Try and speak clearly and use humor if appropriate. Be clear when making promises and only promises that can be delivered. Sadly, in prison, it's not always possible to speak to prisoners in a confidential environment. Most of the time, these conversations would take place in a shared cell. Whilst I would attempt to ensure the cellmate was out of the cell, this was not always possible. People with mental illness may be experiencing auditory hallucinations, feel depressed, very anxious, and have mistaken beliefs and disorganized thoughts, coupled possibly with feelings of persecution. These symptoms can interfere with their ability to engage in rational discussion. Let them know you understand how they feel rather than questioning their delusions. And if you question the reality of their delusions, they are likely to react and become argumentative. People with mental illness can feel inferior, lonely, and demoralized. They present as having a lack of respect and regard for others. It's easy to react, but better to show acceptance and compassion for what they're going through and offer hope and understanding. Hope is, after all, a major Christian virtue and is one thing that as Catholics we can offer. People who are mentally ill sometimes feel hopeless and helpless. Give a message of hope that things will get better and express positive feelings. Mental illness can often affect how sufferers perceive and respond to others. And this can present as being unresponsive to what is said and unenthusiastic to suggestions. This may be because of confused thinking that is inhibiting the person's capacity to understand you. Don't take it personally. You may be doing better than you realize, even when the task seems to be very uphill. People who are feeling depressed or needing someone to talk to in prison are helped by the listener scheme. All prisons have a listener scheme, and this is designed to help those who need someone to talk to. Prisoners are trained by the Samaritans over several sessions, followed up by regular support meetings. And the purpose of listeners is to do just that, listen. They're available day and night, and the aim was to have at least 2 listeners on every wing. I was asked to also give a few tips about going into prison. I never forget the first time that I went into prison and the electronic doors slid shut behind me. The thought flashed through my mind, am I ever going to get out of here? Prison can be a scary place. Just remember that most prisoners are just people who have made mistakes. We all make mistakes. They have been caught. Most prisoners are okay, some are not, but you soon learn who those are. It's important to follow the rules and also instructions from staff in prison. Teamwork is also important. Security checking for visitors and staff is a big part of prison life and can be stressful and time-consuming, but it becomes familiar over time. Realise your personal limitations and the fact that you are no bigger than the system. Observe what is going on around you. Liaise with colleagues and wing staff, and take every opportunity in prison to find out what's going on and what the mood of the prison is. I was lucky in that as a chaplain, I had the opportunity to go to the governor's morning meeting and found that useful. It gave me a chance to find out about staffing levels, violent incidents, if there have been any significant finds of drugs or weapons. Also, it gave a rundown of events happening in the prison and what was happening in other departments. As I said before, attitude to prisoners is important. They're ordinary people who have made mistakes. And if a prison cell is visited, know where the door is, trust your feelings, read what you can about a prisoner's background. All staff in prisons get issued with a whistle. Here's mine, my 170th anniversary whistle from Pentonville. Blow your whistle if you feel you are in danger. I only ever blew my whistle once in prison, and that was when I saw an officer, female officer, struggling to restrain a prisoner on her own. When I blew my whistle, 3 other staff appeared in seconds. I always carried a radio so that I could hear what was going on and where trouble was in the prison, so I could avoid it. If you ever have the opportunity, visit a prison, ask chaplaincy or healthcare or someone from your own speciality to arrange it. Volunteering is also a possibility in prison. I had chaplaincy volunteers who used to help at Mass on a rota. The local Legion of Mary came in on a regular basis to Mass and provided volunteers for us. However, for the time being, COVID has put pay to all prison visits and volunteering, and there is currently no Mass in most prisons. Just to conclude with a few points. Please look at other resources on prison. The Prison Reform Group is a very good source of information. The director of the Prison Reform Group was actually the governor at Highdown when I was there. The Women's Institute have done a project, Care Not Custody, and they have a short DVD on the effect of a death in custody, which is well worth viewing. Finally, what is the way forward? Firstly, look carefully at the amount of people we imprison and conditions in prison buildings. An officer once said to me about the cells in Pentonville that he wouldn't keep his dog in one. Are there other alternatives to imprisonment for people who are not a danger to the public? Why do we continue to imprison the elderly? Why don't we have more secure care homes for them? What about more secure units to deal with mental health, drug and alcohol addiction? The Dutch system is interesting. They have separate treatment units for offenders with mental health difficulties, and they move through degrees of security as they become better. Prisons are being closed in Holland. They don't need them. I haven't got time to go into this in detail, but do look at it if you're interested. While a lot of money is put into drug abuse in prison, it doesn't seem to be working. A lot of revolving door prisoners are feeding a habit. Homelessness amongst discharged prisoners needs to be addressed. Yes, all this costs money, but so does the existing system. I don't pretend to know all the answers. All I can do is to tell you that the present system doesn't work, and imprisoning more and more people doesn't seem to me to be the solution. Please pray for chaplains and prison staff. It's a hard job. Thank you for listening, and I'll be pleased to answer any questions.